Allergic reaction after double eyelid surgery. After about a month of healing, my eyes began to look decent enough that I stopped panicking every morning. Then a cat triggered allergies I did not know about. Immediately after rubbing my eye, thought after a month this would be okay, my eye swelled and deformed. The swelling subsided within a few hours, so I know this is not an infection, also confirmed with doctor. But the next day, the eye looked as it did when it was 2 weeks post-op, high, unnatural. Is this permanent? Did rubbing do damage?
Thank you for your question. You stated in your question that you had Asian eyelid surgery approximately 1 month prior and that you were panicking every day, but now things had settled down and you were feeling good. And then along came a cat-related allergic reaction that result in eyelid swelling and then rubbing. You want to know about the consequences and the impact on your eyelid surgery. Well, I can certainly help you. I'm board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon, specializing in Asian eyelid surgery, practicing in Manhattan and Long Island for over 20 years. So I think that this question is very straightforward, particularly since you described a period of time where you were concerned and then finally things settled out to the way where aesthetically the eyelids looked fine. Understanding the principle of what was done with your eyelid surgery is critical. So let's just start with that. Whether you underwent a non-incisional or an incisional Asian eyelid surgery, the key to both procedures is a connection between the skin and the levator muscle. The levator muscle is the muscle that lifts your eyelid, and it's like the word elevator without the letter E. When the skin is connected to that muscle, what I'm always concerned about is the early period of healing when the swelling could potentially put pressure against that connection. Now, it is possible for a crease to diminish later from just movement and stretching, but at least in the early postoperative period, that is one area of concern. Now, the fact that you looked good up to the point of 1 month and then you had this swelling, well, with the photos you submitted, it doesn't look like you're in bad shape. So chances are the swelling was limited to a relatively small degree, and even with eye rubbing, which is natural to do when you have an allergic reaction, it doesn't appear that you've done anything to detach those connections. It actually takes effort. Once those connections are made, the wound healing process is ongoing in terms of the collagen remodeling and the strengthening of that connection between the skin and the muscle. But as a general rule, once it holds very, very well. So I think that it is, again, and I would say it's important to understand this opinion is based on a history and photos. Physical exam being a very critically important part of this, I would suggest you go back to your doctor who did your surgery, just for peace of mind, to just kind of look and see how your skin looks and how the area looks, and possibly there may be some value in terms of guidance with allergies. You know, it's not unusual, this type of story. People discover all kinds of allergies during the post-operative period after cosmetic eyelid surgery, and occasionally we need to manage them with topical treatments, with oral treatments, and so there may be some value. Even eye drops can also have some role to reduce the impulse to cause you to want to rub your eyes. So I think meeting with your doctor to discuss this situation and how to manage it should it happen again, understanding that this is your cat and that this, or whether you're going to be exposed to this cat again, it's you want to be proactive, and it may mean taking an antihistamine or something else, or eye drops and the like to manage and be to prevent this from happening again. But from a general perspective, with the photos you submitted, it doesn't look like there's anything to be concerned about at this time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.